Marissa Armstrong. I'm a Senior Communications Specialist with Clark County Public Health, and I am here with Dr. Stephen Krager, the Deputy Health Officer for Clark, Cowlitz, and Skamania counties. We are going to address some frequently asked questions that we are hearing from folks in the community. So what steps are being taken to ensure equitable access to the COVID-19 vaccine in Southwest Washington?
So I will say the counties, as a part of this incident management team, Clark, Cowlitz, and Skamania, we're committed to, equitable access. We want to make sure that people that want the vaccine are able to get it, and it's an easy process, as easy as it possibly can be. So part of this is, we're opening, when we have more vaccine available, we're going to be opening more sites that people have, or that we will have, that people can go to access the vaccine that might be easier for some people. So different kind of geographic locations that people will be able to go, that we will advertise and make it clear that you, if you meet the criteria, you'll be able to go to these sites and get vaccinated. This will be kind of mobile sites as well as fixed location sites. We want to do workplaces, that's going to be a big one. Schools might be a part of that, where we vaccinate staff within the school and possibly other people if they're eligible. So we want to provide, access to locations where it's easy for people to get to, especially if you struggle with transportation or don't have consistent transportation, where, going to, say, the fairgrounds might be a struggle for you. This is important for a lot of reasons, foremost being that the COVID-19 pandemic has greatly affected, proportionally greatly affected persons of color. And these communities are critical to outreach to with vaccine in order to slow spread in those communities. So, these sort of places are critical, and we want to get to them. That might look like a food processing facility where we can reach hundreds of people and other critical workers. We have lots of ideas and lots of plans for how we might, bring vaccine to people and make it easier. In Clark County, we've also opened a call center, and we have interpretation services available for people. This call center will help you sign up for the web form. This web form that Clark County has to kind of get on the waiting list for vaccine. It doesn't mean you're going to get an appointment, but it means when we get to you on the waiting list, we will refer you to a healthcare provider who will then call you and get you an appointment. So we have access to multiple languages that people can use with that call center, and hopefully that will help people who have language barriers. We're also reaching out in all our counties to various community groups, local, neighborhood associations, nonprofit organizations, free clinics, other healthcare providers, to try to come up with other ideas about how we can outreach to those people that have been disproportionately impacted. So that's some of the work that we're doing.
There are a lot of people who want to get vaccinated but can't access the vaccine. So when will the vaccine be easier to access?
The straightforward answer is that we don't know right now. We know generally that vaccine supply is very limited. So, we're getting a couple thousand doses in Clark County, a few thousand a week. We know in Clark County and across actually the region, we have over 100,000 people that are in the 1B1 category. So that's going to take potentially weeks or even months if we stay at our current level to get through all those people. What we've also been told is that eventually these vaccine supplies will increase. But they haven't given us a timeline. So, vaccine manufacturers are working as quickly as possible to produce as much vaccine as they can, but it takes time for them to ramp up their production. So we're waiting for that to happen, and until then, we have to be a little bit patient. I know that's really hard. This is, incredibly difficult time for lots of people. People are getting sick and dying from COVID-19. People are struggling with, mental health as they have isolation. Kids are not, getting great access to school. There's lots of reasons that we want to get the vaccine out as quickly as possible, but we keep running into this supply issue. So there's more people that are eligible and there's more people that want the vaccine than there is vaccine available. As we get more vaccine, there will be more appointment slots that open up. More people will get calls, from that web form that you will, that you'll have a vaccine appointment. So we don't have a great timeline right now. We hope, and we've been told that access is going to increase, the supply is going to increase in the coming couple of months. And we hope that happens because we want to continue this work to vaccinate as many people as we can.
All right, thank you, Dr. Krager, for taking some time to answer these questions. And everyone else can stay tuned for future videos that answer more common questions that we hear in the community.